Good evening and welcome to NAACP Lancaster's COVID-19 Crisis Series. The NAACP's mission is to secure the political, educational, social, and economic equality of rights in order to eliminate race-based discrimination and ensure the health and well-being of all persons. To this end, NAACP Lancaster has collaborated with local hospitals and community organizations to host several pop-up clinics providing much-needed vaccinations to our communities of color. We're also hosting the recurring COVID-19 Crisis Series throughout the pandemic to aid and educate our communities. My guest for tonight's COVID-19 Town Hall event is Dr. Ify Ndukwu. Dr. Ndukwu is an internal medicine specialist in Hershey, Pennsylvania. He graduated with honors from Pennsylvania State University College of Medicine in 2013 and has more than 8 years of diverse experience. Thank you for joining us tonight. I believe what I'd like to do to start is maybe just ask a pretty broad and simple question, which is, though it took some time for us to develop, actually, you know what, I'm sorry. Let me make sure that participants know that if you have questions, you may ask them in the chat box and I will be able to give your questions to the doctor and he'll be able to answer them. I also have questions of my own and I was jumping ahead because I was super excited to talk to you. So we'll start again. So even though it took some time to develop, we now have several COVID-19 vaccinations available. Could you talk a little bit about what the differences are between some of these vaccines, maybe in relation to the availability of some, the efficacy of them, maybe side effects that you would maybe experience when you have them?
Okay, so right now there are 4 vaccines readily available that have been approved for emergency use authorization in the United States. So what emergency use authorization means is that we have access to them, we can use them, but it's still the warning and caveat that it hasn't been through absolutely all the normal stages process of research, background, follow-up. Although a lot of research has gone into developing these vaccinations. So the first one we heard about was Pfizer, right? Pfizer Biotech. That was the first vaccination that came out. Around the exact same time, the Moderna was approved as well. So you have Pfizer, Moderna that was essentially approved right around the same time to each other. They were only a few weeks apart, if I'm not mistaken. And then you had the next vaccination that was approved in the United States was Johnson & Johnson. And then now we have the AstraZeneca that's being approved in the United States. So in terms of the differences between these types of vaccinations, so it's actually kind of easy because you can group them into 2 general categories. So Pfizer and Moderna were designed with the same technology, and the Johnson & Johnson AstraZeneca was use a similar technology, but they were different. So Pfizer and Moderna, what technology they use? So they used a relatively new technology to essentially inject the body with a type of RNA that would stimulate the body to create a protein that the body would then use to build up antibodies to fight the infection for. Right, so it was groundbreaking, brand new technology. They've been working on it for years and trying to master it, but this was the first time they've been approved for actual use. But they had been trying to develop other types of vaccines for other types of diseases. Zika, right? We heard about Zika several years ago, and that was when they started working on trying to develop using this new technology to create vaccines for certain types of diseases. So Moderna and Pfizer, they use this. So it's called RNA. It's an RNA virus. So what it does is that it injects this RNA, it stimulates your body to create the protein from that RNA, and then your body creates antibodies to that protein. Very, very ingenious technology. Pfizer and Johnson & Johnson and AstraZeneca use a different technology. So essentially what they use is it's called a vector. So what they use is a virus vector. So it's a virus that has all the ability to replicate and cause disease removed from it. And it has only the DNA to produce proteins that your body can then produce antibodies to fight the virus for, right? So different technology, and that's technology we've been doing since the 1970s. That's how we've been creating viruses for a very, very, very long time. So it's different technology, different approaches, The end result is that the body produces a protein that you make antibodies for to fight and prevent infection. So those are the two main categories: Pfizer, Moderna, AstraZeneca, Johnson & Johnson.
Okay, that's fascinating. That's really interesting. I feel like it leads me to a question that I have, which is, so despite having these vaccines now, we are still seeing multiple mutations or variations of the COVID-19 virus. What does that mean then in terms of the vaccinations that you just spoke about, either for the current strain or what it would mean for the strains that are kind of newly emerging?
So that's actually a really good question. It's a really interesting question. So Pfizer and Moderna were the first onto the scene. They were first, they were first to develop the vaccine and first to get it out and start testing it in people. And then after they developed their vaccines, and after we had found out they were how efficacious they were, which was very, very efficacious, we started seeing these different strains pop up. And that's the threat and concern with why there's such a huge rush to get everyone vaccinated. The more strains that pop up, the more you get concerned that that mutation is going to be just enough to change what our antibodies are targeting to protect us. So what are antibodies that these vaccines stimulate? What they do is they target the proteins on the virus, so it prevents them from even infecting our cells. And that's how the vaccine works. We get injected with the vaccine. We put up basically a whole wall of antibodies that bind these proteins, bind these viruses, and prevent them from coming in. The concern is, if we don't get enough people vaccinated, eventually you'll get a mutation that won't be recognized by the antibodies that's created by these vaccines, and then you can be infected that way. What's nice about for example, the Johnson & Johnson strain is that it's actually extremely effective against the more deadly and more recent mutations that we've been hearing about in Africa and Europe, which is fantastic. And that's where they did their research studies when they were trying to figure out how effective that vaccine was. So the reason why it's concerning and the reason why we're trying to pay attention is because we're trying to build up the immunity of the entire populace. So to the point that if you do get mutations, it won't devastate a community, it won't wipe out a community, or all we need to do is do a booster vaccination potentially to fight a new strain, right? That's why the importance of that's why the importance and the rush that you see these governments trying to get their entire nations populated exists. JoAnna, you're muted.
Oh no, I'm so sorry. We talked about getting everyone vaccinated as quickly as possible, and that's like talking about herd immunity. Is that that's a term that I'm not sure everybody necessarily knows, and perhaps it can lead into some good conversation about getting vaccinations and why. But could you explain very quickly what that term herd immunity means and what it means as far as making sure you get your vaccination?
Oh, absolutely. So I will oversimplify it because it makes more sense when you oversimplify it. So the concept of herd immunity is that there are enough people with immunity to the disease that even people who aren't vaccinated or who haven't had the disease yet, because they're around other people who've had the disease, they're protected, right? So the thing with this COVID-19 is that you can pass on the disease even though you have no symptoms. Right, and that's the reason why it's scary. If you had symptoms that everyone showed, well, everyone would just keep their distance, and that would be that. It'd be easier to stamp out. The problem is that there are several people, and there are many, not just several. There's a whole populace of people who may show no symptoms or extremely mild symptoms that mimic regular common flu, common cold symptoms, and in that process they infect someone. So this concept of herd immunity, right? So just to simplify it, so let's say there are 10 people in a room. And in normal situation where none of them are vaccinated or have had the disease, if one person gets infected, they have a higher chance of infecting a good portion of those 10 people in the room. Now, if you have herd immunity, right? If you have 5 people in that room who are vaccinated, right? So now those 5 people are protected from getting the disease, and they're also protected from passing on the disease. So now you have those 5 people who are protected in a way that wouldn't be. So let's go back to that previous example where no one was vaccinated. So you have 10 people in a room, let's say 3 or 4 of them are infected. That's 4 people who can infect the rest of those 10. You go back to that other group that has 50% of the room, 5 people vaccinated, you're not going to have the same 4 people who are infected. And let's say you did, then they can only infect that one person, and they can't infect the rest of the 5, right? So you technically, by being in a group of people who are already vaccinated, they're protecting you from getting the disease because they're not passing it on to you, and then they're not leaving that group, walking into another group and passing it on to someone else. So that's this concept of herd immunity. But you have to get people vaccinated and protected enough to a certain point where it truly starts protecting other people.
So what do you say then to either patients or other people that come in and they're like, well, I'm just going to wait for the herd immunity? Oftentimes people will say, they're not going to wear their mask or they're not going to do other things. But some of the things, I'm just going to wait. I'm going to wait. And when everybody else gets it, then it should be fine. What would you say to them to convince them, like, you should go ahead and get your vaccine anyway?
So that's a great question. And it's a common theme that you hear, right? The issue with that strategy of, oh, I'll wait and see, is that you don't necessarily know when you might get infected. Or if you're infected and you infect someone else who might not have the same natural immunity that you might do. And by natural immunity, I mean natural susceptibility, right? Some people we know have symptoms, other people die, right? And that's the concern, that in the process of waiting, you could stumble across someone who infects you and you may not survive, or you maybe have severe downstream effects, or you have no symptoms, but you pass it on to someone who cannot survive, right? And you pass it on unknowingly to someone who cannot survive. So waiting doesn't help. And the more we wait, unfortunately, back to your previous question, the longer we wait to get everyone vaccinated, the chances that we increase the probability of a mutation arriving where these vaccines are no longer effective. And that's the biggest fear. That's the biggest concern, is in the process of waiting, there's a mutation. And now that mutation can affect a lot more people because a lot more people waited and didn't have the protection inherently built in that would have come across with getting vaccinated and developing a general herd immunity to a community.
I see. We have a question from someone from the group, but I wanted to ask one more thing that was linked to that, because so looking then at building that herd immunity and doing vaccinations, how is the COVID-19, how is their projection going compared to perhaps other vaccinations of things? And this is a pretty deep historical question, so if you don't know, I get it. But thinking about, how long did it take for things like polio for that to have gotten, had as much of a herd immunity as possible, and we get these boosters, but we don't have to do anymore. Like, is COVID-19 on the same track to be sort of contained or curtailed in that way?
So that's
hopefully very soon.
No, so that's a great question. So think about the polio vaccine and smallpox and diseases that we've pretty much stamped out, right? Those vaccines were built in an era where technology was not able to be produced at the speed at which we're doing, right? So no matter how we look at it historically, our treatment and our vaccination of COVID-19 is going to astronomically outpace anything that's ever been done in recorded human history. The fact that we were able to roll out a vaccine in a year, never been done in recorded human history. The fact that we were able to mass produce it to the extent that we are with such different, so many different companies and pharmaceutical companies pitching in, never been done in history. So we will annihilate the record to getting the COVID-19 vaccination under control, even with people delaying. But again, it comes back to that fear, is that we don't want to delay too far, because it is a disease that has affected people like no other disease has in human history. So it's different on par on that level as well. But we have the technology and the science and the financial resources and communication resources to do things that were never possible. So it's in a way, what we've been able to do this last year is a triumph of the human spirit and creativity and perseverance. We've come a long way.
No, that's so fascinating. Thank you so much. We do have a question from the audience, from Rand, and it says, now that I've had both doses of Moderna vaccine, I have a question about symptoms in the event that I'm exposed to COVID-19. After my second vaccine dose, I experienced headaches and total body aches and chills, and my body was very hot. It lasted for about, I think, 18 hours. The question is, if he's exposed to COVID-19 in the future, what could he expect as far as symptoms if he were to test positive for it?
So that's a good question. So now that you've had your second dose, the time period that we tell people that you still need another 2 weeks to fully develop immunity. It's the general timeline it takes for your body to produce the antibodies to a level where you have protection against reinfection. All right, so now setting that timeline aside, so let's say 2 weeks from your second dose, you now have the immunity that you're supposed to have. Now, what's nice about this vaccine is that it prevents at a 95% clip, so, symptomatic as well as asymptomatic disease. So you may come across someone who's infected, who would have infected you before you received your vaccination doses and may have no symptoms. You may never, and 95% of the time, you're not going to become infected, right? You're not going to become infected. Now, if you do become infected, the beauty of this vaccine is that your symptoms will be very mild. You're not going to be hospitalized, and you're not going to die from it. Those are the key things and the key takeaways, right? You're now protected from severe disease and from death. So you may have a runny nose, stuffy nose. You may have some, a cough or some trouble breathing, but they're going to be on a much milder case. And even then, those are in the rarest of populations. 95% of the time, you won't. If you did get infected, you won't even notice it, and chances are you'll be protected from infection to begin with.
So we have something that kind of piggybacks on that a little bit from Amy again in the audience. She asks, do we know yet whether fully immunized people can pass the virus on to others? And the follow-up is, and do we know if those who are fully immunized, if they contract the virus, can they get long hauler symptoms? I know you said that, death is sort of taken off the table once you get the vaccine, but what about these long hauler symptoms? So can you still pass it on? And if you do get it, could you be a long hauler?
So that's what's nice about these vaccines. So we've because of the population studies that have been done now, that we've vaccinated large groups of people, particularly the study that was done in Israel, which has a large chunk. The majority of their population has been vaccinated. They've been able to study those people, and they have found that the Pfizer vaccine is also extremely effective at preventing the transmission of disease at an above 90% clip. So now we're talking about a vaccine that not only protects you, keeps you from developing the disease, prevents you from dying, but it also helps prevent the transmission of disease. Now, it's not 100%, right? So on some level, yes, technically you can prevent, so technically there's still a risk, but at a 95% clip of preventing the transmission of the disease, that is great. So not only do you protect yourself, but you protect, by having the vaccine and being completely vaccinated, you protect other people from potentially being infected. And then to answer your question of if, I believe the second part of that question was if you were to be infected after the vaccine, could you then transmit it? Was that correct?
That was one, right. Can they pass it on to others if you're fully immunized? Can you pass it on? And then if you do get it, would you be a long hauler?
Yeah, so the second part of that question is if you did get it, chances are if you did get it reinfected after you've been vaccinated, you'd have mild symptoms and your symptoms would not last very long. However, those are speculative data that we don't have the longitudinal studies that show definitively people who've been vaccinated who got reinfected, what symptoms they did and how long they lasted. The thought process is because the vaccine prevents severe disease and you might get mild symptoms, that those mild symptoms would not last very long. So unfortunately, the answer to that question is we don't fully know what it means in the long term, but the chances are extremely low of having some severe outcomes.
So, I mean, you're talking, doctor, about all of the positives, all of these benefits of getting vaccinated. I want to talk about two things, and they're sort of related. So I'm trying to figure out which I want to address first with you here. But I think the first question I want to ask is, looking at percentages of vaccinations across the United States, knowing that Black and Hispanic and Native American people are 3 times more likely to die from COVID, but white Americans are being vaccinated at 3 times a higher rate than those other groups. Currently, only about 5.5%, I think, of Black people are vaccinated versus 60% of white people. And there are about 35% of Black people saying they wouldn't get the vaccination at all. What do you see as some of the main factors in that sort of discrepancy as far as them actually getting it, or even saying I will or will not take it?
So the discrepancy is multi-layered and historical in context, and that's a difficult component of this. So I'm going to look at it from 2 perspectives. So I want to look at it from the lack of trust, right? The lack of trust, which is legitimate and understandable. So the historical context of how socioeconomically disadvantaged, colored people, Black, brown, Asian, Native American, people of color in general, they've been treated with disrespect and treated economically as well as differently in terms of healthcare and health disparities. So you have a community that has been not treated as equals to the white community, that haven't received the same equal amount of treatment or even this equal amount of attention. And then we have famous studies where clear wrongs were done against people of color. So that builds in a distrust that is baked in for generations upon generations, right? It's not just 1 year, it's not just one example, it's generation after generation of example after example. And then when you see it in healthcare, when you see it in the judicial system, when you see it financially, when you see it in social economic status, when you see it through all walks of life, natural distrust is bound to happen. So that's why you get this natural distrust. And that's why you have people saying, I don't want to take the vaccine, or I don't trust it, or I'll wait. I don't want to be first in line. And I've heard that too. I want the vaccine, but I just don't want to be the first one. I don't trust. And it's all played out in a historical context, right? The biggest example that people tend to reach for is the Tuskegee experiments. Although it's frequently misquoted, the Tuskegee experiments are probably the example that people reach out to the most. So to provide accurate historical context for the Tuskegee experiments were a study that were done on black men who had syphilis. Essentially, these Black men who had syphilis were monitored and studied and the disease process was allowed to continue and fester. Now, they had the treatment for syphilis. It's an antibiotic. They had the treatment, but instead of giving unfortunately these patients the treatment, they allowed the disease to run the course and unfortunately kill several of them or have severe downstream side effects from the result of 3rd stage syphilis when treatment was readily available. The historical misrepresentation that many people think happened is that they think those men were given syphilis, and that's not true. So the truth was they had syphilis, they were studied, they had many options to treat them, they just didn't do it. But that's well baked into everyone's mind over the generations and generations. So if you have that concept and that mistrust, when you see something that's so new and so fresh and so rapidly produced as these vaccinations, there's trepidation and concern as to being the first in line or even just to receive them in general. So then you have the other side of the coin of, okay, so if minorities are 3% more likely to have severe disease or die from the disease, why are they getting the vaccine at a far less rate than the white community that's technically at lower risk of severe adverse outcomes, including death? And unfortunately, that comes with the territory of baked in socioeconomic status, right? So socioeconomic status, minority disparities, they're built into each other. So unfortunately, the means to access healthcare is harder for minority communities. So if you have harder means in terms of access to healthcare, that means you have less access to vaccines. So a hospital can put up an open sign-up sheet for people who meet these qualifications, but that same group of people in minority communities don't have access to that internet access, or they don't have access to that website, or they're not established with their primary care physicians, so they can't log in to sign up for it. So you have this social economic, problem that is multi-layered, and then it trickles down to those minority communities as a result of the generational, systemic racism that's been imbued in healthcare, as well as the socioeconomic status in general.
Right. No, absolutely. And that's what I was thinking of when I had phrased that question or passed that question on to you, thinking of the Tuskegee experiments, but also thinking even in the sense of something like Henrietta Lacks, in which, scientists used her DNA without permission. I guess I want to maybe see if you could speak a little bit to the fact that I believe that there were, at least for some of these vaccinations now, there were Black scientists that worked on these vaccinations, and that's historically, that's something that's different. Is there any way you could elaborate on that a little bit, or maybe even at least speak so that people can they hear that and they maybe know that perhaps, this might be a way to dispel some of the fear surrounding the vaccines?
Yeah, so this is different in that all of the test subjects, and I shouldn't say test subjects, all the vaccine volunteers to be a part of the research studies to determine how effective they were, it wasn't done strictly from one racial community, right? They tried to be diverse in the racial communities. Now, granted, the overall sample size was around 40,000 for Moderna, 35,000 for Pfizer, although I may have those numbers flipped. But they're technically in that ballpark. So Black, and brown communities were a part of the research testing group, but they were also a part of the people who were doing the monitoring. They were also a part of people who were doing the development and who were research, right? Unlike before, we have a greater amount of minority researchers, intellectualists, physicians who are part of this process. Now, don't get me wrong, we're still an underrepresented portion of that group, but we are in the door. And you need people to be in the door to point out some of these things and to point out some of these issues. And that is one of the biggest changes now. It has a built-in protection component of people who look like me behind the scenes saying, hey, we can or can't do this. And what's interesting, you talk about the Tuskegee experience, for example, compare that to now. So we had a vaccine that was actually meant to be studied longer before we rolled it out and approved it for emergency use to the population. They were going to study it for months longer. However, they realized it was so effective, it would have been ethically or morally wrong to withhold that treatment option from the community as a whole. And that's the fundamental difference of what happened with the Tuskegee experiment, right? They had a treatment, they knew it was effective, and still withheld it. Here we have a vaccine that we know it's effective. We're not withholding. We're trying to get it to everybody. So there's a bit of difference there. And then if you think about the Henrietta Lacks, right? Taking someone's DNA without their consent is absolutely, you can't do it. It doesn't happen anymore. It doesn't happen anymore. There are laws in place against that specifically as a result of that. However, and I'm not trying to justify, and I don't mean to dismiss what happened, but a lot of good came out of that research, because people from years later said, you know what, we can take this research and do things the right way now that we've learned from it. And there was good that came out of it, despite all the bad that was done in the act. And the means never justifies the end results. But now that you have people who are like me saying, hey, we can't do that, that is wrong, you have built-in protections to try to prevent these just human wrongs from happening again.
Yeah, I think, and I'm wondering, it kind of transitions me into another question, but just kind of thinking about this historical aspect of it, and thinking about what is being taught in schools. You know, a lot of people don't know, at least not people of, you know, if they're not people of color, they're not Black, they don't really know these historical incidents that have built up these years of distrust and doubt for the US government when it comes to any kind of vaccines or treatments. But I kind of want to move into this school forum in a minute, because so many schools now are open in almost fully in either fully in person or have very slight modulated, you know, in person and hybrid virtual. Knowing what, I guess I want to ask if you could maybe differentiate a little bit first on, like, how does this virus present in children or in youth versus, you know, what we see for adults? Because I know that when I was sending my children back, there was this kind of tug between taking care of their physical health, but also trying to monitor their mental health, and knowing that being back in school was in the end most beneficial for them. But also worrying that even if they weren't the ones to get sick, that they could bring something home. What are the real, or at least some solid percentages or risks that are actually involved in that? Maybe to clear, because I think some people are also still very, very scared to have their children in school, or are keeping them home when it may be possible to send them. So I didn't know if maybe you could just speak a little bit to some of those statistics.
So this is a tricky and very delicate balance, and not technically, even in the scientific community and healthcare in general, not everyone agrees on what exactly is the right, you know, way to go with this. So, and I preface a lot of what I'm saying by justifying it. So I'm in internal medicine. I deal with adults, and I don't actually care for you know, children, anyone under the age of 18. Now, with that being said, a lot of the symptoms that children manifest are similar to adult symptoms. You know, with, you know, fevers, chills, cough, shortness of breath, runny nose, stuffy nose, nasal congestion. But if anyone who's had kids, or you know, has kids, nieces, nephews, family members knows, kids come home with those symptoms all the time, particularly after starting daycare and things, you know, going to school and being around other kids. So it's delicate, and it is, you know, it's a delicate process, because you do have to think about the well-being of children mentally and their education. Education is extremely important, especially communities of color. And I say that as a man who has 2 professional degrees. So it's extremely important, and you have to be mindful of it, but you have to do it safely, right? So so you need to do it following the guidelines. So we know that, you know, people have been working in the office, people have been working in, you know, people who are considered, you know, essential personnel, have been working in communities, in environments with other people, sticking with regulations, right? Wearing a mask at all times, keeping the 6 feet, you know, of distance between people, trying to be outside whenever possible, keeping that space. And we know they've been effective, because the CDC has, in other, you know, population studies, have shown that 6 feet tends to be quite effective at preventing and trying to minimize the amount of space and minimize the amount of time in a closed space. So opening windows, trying to allow fresh air, has been helpful in these school environments. And they've recently come out with a new study that says the difference between 6 feet and 3 feet for children in schools hasn't shown any change in the transmission of infection, right? So think about what that means. That means that's actually, so it means that a lot of these schools that have been implementing these CDC guidelines of all the students wearing a mask all the time, keeping them 6 feet apart, separating them out, rotating, opening the windows, moving people outside, has been effective and helpful in preventing transmission of the diseases. However, it also means that we know children have transmitted diseases to each other, as well as to their family members at home. Now, So then what does that mean in terms of putting the minds of parents and family members at home at ease? It's delicate and it's hard to say. I'm not even sure there is an absolute right answer, right? The parent who wants to who wants a child to virtually learn from home because there's a 98-year-old grandmother in the home, which would fit my family, right? It's reasonable for them to want that because they're trying to protect the grandmother at home. Or if the family that has young 30s in the household only, no one with any risk factors, who's willing to take a little bit more of a risk, as long as their schooling and program is following the CDC guidelines as much as they can, and they do all the necessary things when they're at home as well. That's reasonable too. I don't think there's necessarily a absolute wrong or absolute right answer here. However, the instances where I feel like that are truly absolutely wrong are the concepts of, well, we're not going to wear a mask at all, because then you're promoting the disease spread. That I have a problem with. Or we're not going to socially distance at all. That I have a problem with. But we've done this long enough now with enough studies to show that you can do these things safely if strict guidelines are enforced and followed.
So it makes me think, now that we're coming, the weather has been beautiful the last, at least today, it was absolutely gorgeous. And, I'm last year at this time, we were on this full lockdown, you didn't go anywhere. You could go outside, like to walk your dog, but, you really were trying to keep things isolated. And we only had at that point, I think 500 deaths maybe a day. The number was substantially lower, but so now a year later, as I see this warm weather coming up, and I'm thinking the people's guard, I feel, against this virus has dropped, even though I guess I should say threat, the risk hasn't really changed that much. And deaths are still, even with the vaccines, are still high, or they're lowering, but they were still high. So I guess I wonder if, do we, or could we expect to see now that we have vaccines, would we expect to see any other kind of spike again, or should the numbers continually just be on a downward trend? I guess what I'm saying is, if people are starting to oh, it's nice, let's go for our barbecue, and hey, I'm not going to wear my mask because I'm sitting on my porch across from you, and can that counter the good that this vaccine is doing?
Absolutely. The answer to the question is it absolutely can be a deterrent. So if you look at the highest numbers that we had December, January, just the highest astronomical numbers that we've had, and we're down from then. But if you look at the last month and a half, the numbers haven't necessarily kept on a downward trend, like a downward free fall like it did in the winter months. It's plateaued, as you were saying, right? So that we still have a high rate of death and we still have a high rate of new infections. And that's what everyone needs to be extremely mindful. The desire and natural inclination to let down your guard is completely understandable. It's completely rational, and I get it, because we've all been through so much. And then you hear about 4 vaccines that are available. You hear about your friends and family or cousins or someone down the street who's been vaccinated. And you think, okay, well, we're turning the corner. And we are, but we're not completely there yet, right? The reason why the lockdown was so effective is because everyone was on their guard. And even after the restrictions were loosened into the summer months, many people were on their guard, and you still saw significant spikes. And you kept seeing significant spikes after regulations were relaxed. So it's not that we can't have some semblance of a normal life, but you need to wear your mask. You need to socially distance where possible. You need to avoid people who would be at higher risk if you're not vaccinated and if they're not vaccinated. So it is a significant concern. It's actually why you see the CDC continuing to recommend everyone follow appropriate social distancing and mask wearing guidelines, so we don't result in another spike that's significant before the vaccines can catch up and be protective.
Right. We do have a question from the audience. Amy is asking, she's interested if there were any new developments as far as with the virus, with vaccines, et cetera, in the past few weeks that you could maybe inform us about or educate us about today.
So any new develops in the last few weeks. So other than AstraZeneca receiving emergency use authorization, that's probably the biggest one, and also the new social distancing guidelines for schooling and education in the community, suggesting that 3 feet might be just as effective as 6 feet. Is probably some of the big things. Now we do have where we are learning about new medications that can be effective in the treatment of the COVID vaccine. It gets really technical. But there are some new medications that were coming out there. They're showing to help prevent the progression of disease from like moderate to severe to like severe and life-threatening. So, we're still working on treatment medications, and we still have, we have more vaccines, right? If anything, the fact that we're able to speed up our rollout with these new vaccines is probably the biggest and most encouraging, developments that we're seeing.
Thank you for that. We're getting close toward to the end of our time. I'm wondering if there are any last words, either of advice or warning, or just general, like, just do this. We'll get through this fine. There'll still be some snags and kinks along the way, but if we can keep our eye on this prize, we can get through this together.
So what I will say is that if you have the opportunity to get the vaccine, get the vaccine. It is the thing that will change our lives going forward, and it will allow us to return to what we all want, is some semblance of what our lives used to be like, right? Or a complete return to exactly what our lives used to be like. So the sooner you get vaccinated, the sooner you protect yourselves and your family members and others around you. So the sooner you get vaccinated, the restrictions like the CDC has shown, if you're vaccinated, you're actually allowed to be with other family members who are at lower risk, who haven't been vaccinated. It's that effective. So think about that. So that means if you get vaccinated, your neighbor gets vaccinated, you can start doing community events. You can start doing events in each other's household because you're all vaccinated, right? And the CDC has even declared that if you're in a room with other people who are vaccinated, you don't actually have to wear a mask. Right. So think about the small gatherings of 5, 7, 10 people, and you're all vaccinated. Well, before you had to wear a mask, maybe now you don't have to. So be mindful, right? Stick with the social distancing guidelines. Try to maintain your 6 feet of distance. Wear your mask out in public. Protect yourself. Protect other people. Protect other people from you if you unknowingly may be contracting the virus. Right. The more we work together, the faster we can get over this hump, the faster we can get back to our lives the way we knew them, and the faster we can get back to being a community that interacts socially with each other.
Dr. Ndukwu, thank you so much for being here. You really enlightened me on so many of the nuances that surround this virus, understandings of it, social and public perceptions of it. We really appreciate your expertise and your presence here with us tonight. I will close by saying this. NAACP Lancaster's COVID-19 crisis series will continue on. We have another one next Tuesday at 3:30, on the 30th of March at 6 p.m. Please keep an eye out for registration details. And if you have questions or would like more information about vaccines and upcoming vaccination dates through the NAACP, please contact our branch at 717-405-3115. Thank you so much again for being here, Dr. Ndukwu, and thank you all for joining us. I hope you all have an excellent, safe, and healthy evening. Good night from NAACP Lancaster.